Emergency care provides life-saving medical treatment and support to critical ill or injured patient with a complex medical condition. So, those who are working, you are all student. Now, after you completed your BSN, you are going to work in clinical setup. So, those who want to work in critical care area, you need to have knowledge about, in-depth knowledge about all the disease condition. Now, the innovation in field address challenges such as limited resources and time-sensitive decision making for triaging. Triaging means prioritization of the patient. Like in critical care patient, we are not admitting all the patient in critical care unit. For example, you have fever, we will not admit in critical care area. Critical care means life-threatening condition. We will see one by one
Hello,
later in
hello,
recent year, because my topic is current trends in
hello.
critical care nursing, there are lot
Hello,
of research now. Mainly after the COVID, there are a lot of new technology or advanced technology introduced in critical care setting, like intelligent
அவங்க
monitoring,
கேட்கறது
alarm
அட்ரஸ் மட்டும்
system,
சீக்கிரம்
and
கேட்குறது மேடம்.
also there are a lot of new technology going on
அப்படின்னா மீட்டிங் அவங்க
in
கேட்க சொல்லுங்க.
India
இல்லைன்னா
as well as in other state also. Worldwide.
சப்போஸ்
I'm
பர்சன்
talking
பேசுறது
about now
கேட்கல,
worldwide.
ஸ்க்ரீன்
The
தெரியுதுன்னா
new
விட்டுருங்க.
concept and design
மியூட்ல போட்டு
gradually
வச்சுருங்க.
form in recent year. The advanced technology,
அது
now the
சொன்னா மாற்ற
advantage of
மாட்டாங்க,
advanced
எத்தனை நிமிஷம்
technology,
பண்ணி.
timely discover and solve problem in management of patient, improve efficiency, reduce medical service error caused
அவங்க
by
ஸ்க்ரீன்
human factors,
அது
optimize
ஃபர்ஸ்ட் இருந்தே அப்படிதான்
the
இருக்கும்.
allocation of human resources. We don't
அவங்க
have a lot
ஸ்க்ரீன்
of
தெரியுது, அவங்க
nurses to
வாய்ஸ்
working
கேட்கலன்னா
in
விட்டுருங்க.
critical area, but there are a lot of resources nowadays. They are reducing because everything now new technology optimize the use and monitoring of instrument and equipments. The definition of critical care. Critical care means, as I mentioned, the care of
அது
patient
ஆட் ஆன
who
பிறகு
are
உங்களுக்கு தான் பெனிஃபிட்
extremely ill, whose clinical condition is unstable. That means the
நம்ம
patient is
ட்ரான்ஸ்ஃபர் கொடுத்தீங்கன்னா
fully dependent
இது
with the nurses. The definition of critical care unit, this unit specially designed and equipped facility staffed by skilled personnel. We are not assigned, or you cannot work with the critical care area without any knowledge about critical care setup. You need to have special knowledge to take care of patient. Those patients in critical care area fully dependent with a life-threatening problem. Critical care nursing, caring of high acuity patient requiring intensive monitoring and organ support therapy. The critical care nursing. That means patient need fully support. So high acuity patient like unconscious patient, head injury patient, and that means fully dependent. The unconscious cardiac patient. This all patient admitted in critical care area. You are dealing with a patient with a one-to-one ratio. That means one nurse with one patient. Sometimes, according to the acuity level, some 1:2 or 1:, maximum 1:3. The nurse will able to apply knowledge, skill, and critical thinking in holistic approach to caring for those actually unwell patient and their family. Not only the patient and family as well as. So what you need to have, you have to have knowledge, skill to deal with the critical care patients and family. Critical care nurse, as I mentioned before, you need to have depth knowledge of anatomy, physiology, pathophysiology, pharmacology, and advanced assessment skill, as well as ability to use advanced biotechnology. Nowadays, paperless system in worldwide. So you need to have advanced biotechnology, advanced technology, everything computer based carrying going on here. So you need to have in depth those clinic you don't have, the outpatient area, just patient coming for fever. You are just assisting the patient with the doctor, giving the thing, giving the equipment, giving the instrument, or assistant holding the head like that. Those who are working in outpatient setup, but those who want to work in critical care area, You need to have knowledge of anatomy, physiology, pathophysiology, even pharmacology, and not only knowledge, you need to have advanced assessment skill, how to assess the patient, and the ability to use the computer. That means advanced technology. Critical care patient, the critical ill patient as one of the high risk for actual and potential critical life-threatening health problem who requires intense and vigilant nursing care. What makes them special? Why we are telling we need to have those who want to work in critical care setup. You need to have using clinical judgment. Judgment is mainly important, most important, because you are working with many people in many healthcare many healthcare workers in critical care area. So if the patient condition change, you have to have skill for judgment, problem solving skill, conflict resolution. All skill is required those who are working in critical care area. Then being an advocate. Advocacy is important for nurses because you know the caring people is most always the patient feel you are advocating. Don't rude with the patient. I had experience in India. If the patient admitted in critical care unit, the patient deteriorated or patient has some involuntary movement or involuntary urination, they are shouting to the patient, don't do like that, those patient admitted in critical care area. Showing them you are advocating with the patient, you are advocating to the patient, give psychological support to the patient. Demonstrating caring practices. You need to demonstrate, I am always with you, I am taking care of you. So patient already have lot of problem. They are even family also. You need to demonstrate, I am your advocate. I will take care of you. Anyway, you are all student. I am teaching in College of Nursing. Later part, you will work in any clinical setup. Always remember this, all the special needs. Always remember, you need to show them you are advocate for all the patient. Need to have clinical judgment, take care of the patient, demonstrate you are with them, collaborating with multidisciplinary team. You know that critical care. There are with a lot of team like respiratory therapists, anesthesiologists, medical, and different specialty doctor. So you have to have skill how to collaborate with the multidisciplinary team. Demonstrating and understanding cultural diversity. That means all the patients they have same culture. No, there are different cultural people, different character people, different habits people, different religious people. You must know how to demonstrate, how to deal with this kind of patient. Providing patient and family teaching, that is most important. Not only giving care, you need to give education to the patient and family how to avoid the disease in future. Current trends in critical care nursing. These all are the current. There are a lot of trends going on, but mainly I am going to focus after COVID. Mainly after COVID, in my experience, what is going on? Artificial intelligence. Everywhere they are using AI. Critical care medical sensor and devices. We don't want to touch the patient. Everything you can attach with the patient with a small monitor, everything you can see, whole body, what is going on. Nurses informatic, that means yeah, all the records now paperless. Everything you can enter the patient file number is showing all the information. Communication technology, telemedicine and telenursing. That means you don't want go to the hospital. You can call the patient through video or you can contact patient through mobile. They will explain everything. We will see one by one. What is meant by AI? Artificial intelligence. It is referred to the simulation of human intelligence in the machine that are programmed to think and learn like human. You know, you have with the mobile nowadays. We are using mobile. If you want to like how to operate the laptop, you will just click. It will show step by step. The same thing now in the hospital setup also. Human intelligence in the machine. If you will enter patient is having fever and cold, hold. When you enter, it will analyze all the data. The same thing the hospital nowadays, new trend going on AI system. This one will improve the field of critical care and enhance patient outcome. This AI algorithm can analyze the patient data such as medical record, diagnostic images, and assist the nurse in accurate and timely diagnosis. No need to look for others. Don't need to look and what is that? Refer book, nothing. The AI will analyze everything once you enter the patient data. What is the advantage for ASA? Why we need to AI in healthcare system? To save time, energy, and money. I told you now, reducing the human resources, reducing unwanted resources, and reducing and save time. You can analyze the data immediately. No need to discuss. The AI will analyze all the patient condition, what is going on, what is the progress, and what decision we have to make. Everything that machine will analyze to avoid unnecessary walk to hospital for minor, like we don't, you don't want to go to other department, bringing the patient one department, another department, no need. The AI will analyze everything to avoid excessive physical burden. As I mentioned, to avoid misguidance. That means when you no need to calculate, you don't want calculation now, calculator before we are using the calculation, now no need. The machine will analyze everything. Not only like that, if the patient is has any allergy, the AI, the machine will pop up, patient is allergy, don't give medication. So we can avoid the medication error, and it is good for patient and enhance the patient outcome. To provide necessary care to needed one, and use e-referral system to connect to another hospital, like the if cardiac patient is having diabetes, through electronic referral system we can get appointment with another consultant. See, current trend in critical care, this is the one application of AI system in the critical care areas. It will, when you enter the data, the sender one, that is the patient, it will recognize the disease, what is patient condition, and predict the disease progress. And patient is okay, patient vitally stable, or physical condition is okay. Everything the machine will progress, and the doctor can make decision making. The treatment, we need to improve the treatment or no need, or patient can go to continue the same treatment, and recognize unique pattern of complex data. This data will, everyone can analyze the data. If any modification or anything, they can, any reconciliation for the medication, the doctor can decide through this AI machine, but it will save time and energy, but it will give the good patient outcome, that is improve patient outcome. But there are challenges also, because what is the challenges here? Interpretability. That means sometimes the interpretation of data may be wrong. So if it is wrong, all the patient will receive wrong treatment. There are challenges. Sometimes I will interpret some other way, someone will interpret another way. So maybe these all are the challenges going on. Decrease clinical readiness, but some people, they don't know how to use the AI system. Data privacy and sharing, that means no confidentiality. Anybody can view the patient data, and anyone can spread the patient data to anyone. And suboptimal adherence to the standard. Maybe they will not have no policy, procedure, no orientation how to use the AI system. Guidance for future, that you are all future nurses, because you are student now. Your period, I think, when you completed in your BSc or master, when you go out, there is, as I mentioned, there is no paperless. So you will use the AI system only. So now itself you can learn, you will develop your knowledge about the AI, read the many articles, read the research, no paperless. Remember, always no paperless, okay? That is the future trend, that is the current trend now in everywhere. So guidance for future, efficient data transfer. They need to have knowledge about the how to transfer the data. Data De-identification is most important also. Rapid progressing. It is progress now rapidly. And quality control is important. Without quality, we cannot work anything. That means everyone has to have orientation about how to use the AI system and how to interpret the data and coordination and everything. Quality is important. Before introducing something, they will work the quality. It is working or it is not working. It is going well or not going well. If not going well, they will think how to improve to make it successful. Then decentralized federated learning. That means collaboration and coordination is most important in critical area. Everyone has to have knowledge about how to use the system. Now, sensor monitoring, critical care medical sensor. Second part, critical care medical sensor and devices as a most important dynamic of patient care, providing effective treatment mean using tools and equipment that are accurate as they are immediately response. Whatever we are using, the sensor, whatever we are using, is must be accurate reading. If it is inaccurate, the patient will get wrong treatment. In this guide, we dive into the sensor technology role in critical care devices, providing effective patient treatment. You know, the sensor is very small, but it will identify the biggest indicator of the potential issue. Very small, but everything it will. BP is high, it will show. The vital signs is unstable, the sensor will show. And the sensor, they are attaching to the body part of, if you want to check the intracranial pressure, they will apply in the forehead. If you want to check the IOP pressure, just one click, it will show everything. I will show you the picture what is here in critical care department. Here, ventilator monitoring, the sensor will analyze the patient exchange of the air and what is the oxygen level, PO2, PCO2, everything. The ventilator will monitor. Catheter, when you insert the catheter where you can monitor will show what is the patient. That means intracranial, as I mentioned, intracranial pressure during the angiograph. They can see very shock and everything. Then there are lot of sensor we are using. So during surgery, they are just scope only. They are what is the endoscope they are inserting, but the scope monitor they are viewing what is inside the what is it. Where is the block for the patient? During the surgery, if nasal surgery, during the surgery, they are introducing, they are inserting the scope through the nose, tracheostomy, mouth, whatever, but the monitor will analyze all the problems, what is going in the respiratory, cardiac, urinary, abdomen, everything. See tonometry, you can just you can click, it will show your the pressure of the eye. That means intracranial pressure. Dialysis also, the dialysis machine, the pressure ensure optimal accuracy of fluid delivery and volume control. The how much we are delivering to the fluid delivery. If it is overloaded, it will give alarm. So these all are the current trend going on. There are two sensor, pressure sensor and the temperature sensor. This also will improve the patient outcome. Okay. Why it is needed? Critical care in the field, the sensor are improve vital signs monitoring. So improve vital signs monitoring means if the patient is vital sign, they will attach like in the before we are using the thermometer, we are shaking the thermometer, we are we are inserting the mouth and we are telling correct position. Sometimes which is wrong position, it will not give the correct reading. Even in the BP cuff before before what we are using, we are the what cuff we are applying and we are pushing. If it is sometime not in the place correct place, it is giving wrong reading. Nowadays no need this all, making the sensor will give your blood pressure monitoring, pulse rate, SbO2 level and your vitals, your temperature, everything. So it will give timely needed care. That means patient need, like the temperature is high, Immediately we can treat the patient accordingly. Enhance communication between EMS, emergency response team, communicate the sensor. That means they will attach communication. No need to give oral verbal communication. It will, the monitor will show everything. They will open the monitor, or now everyone with the computer, bedside computer, portable computer. When they are entering the patient data, it is giving everything. Reliable remote monitoring when during the transfer, one hospital, another hospital. We don't want to take the old method, taking the temperature, using the thermometer. No need. They are attaching the sensors. Sensor is showing everything in the transfer. In case patient deteriorated, all the things available nowadays, the current trend, they will start CPR or any needed things, that intubation, whatever. But everything it now improve because of the advanced technology. Third one is nurses informatic. You can see here this information and informatic field combine nursing science with information science and technology to improve patient care. It is concerned with the use of electronic health record, clinical decision support system, and other health information technology to support nursing practice and improve patient outcome. Everything through electronic health record. When you enter the data, like nursing care plan, you just click patient is altered temperature or patient is in pain. The data will pop up. No need to go and check. It will show overdue medication. Patient is allergy for this medication. Patient need to take this medication. If it is overdue, it will give alarm. Patient is allergic to this medication. If you are not doing pain assessment, there are policy about the pain assessment. Like 30 minutes, you need to do the reassessment. So the machine will show 30 minutes reassessment to do the patient. Like this all now, there's no need paper. You will record 11:01 temperature done. 11:13 pain assessment done. No need nowadays. Everything through electronic health record. So the young generation, you have to have knowledge about the informatic, advanced technology in nursing. How to use nursing informatic in patient care? As I mentioned, nursing information is a field of computer assist nursing care. Use technology to improve patient care. Nursing informatic tool, it is used to manage patient information, monitor, measure patient progress, and support the delivery of care. This can include managing the chart and record, tracking the medical appointment. Patient has appointment, no need to go anywhere. You can just click and it will show when is the patient appointment. Performing other critical tasks. Patient is having appointment for MRI or any other diagnostic procedure in efficient way. Improve patient care by allowing nurses to access real-time information. No need to call to another department. What is the result of the patient? If the images, what is the next step? No need. This will, you can open the computer in your place. You can see all the information on time, and or any medication. No need to go to pharmacy. Now another technology, pneumatic tube. They will send the medication. It will reach in your area. So positive impact of patient, improve patient safety. That means, as I mentioned, reduce the risk of the patient and reduce the medication error, enhance communication. You will develop your, that means it will give good but you need to have communication skill. If you don't have communication skill, you will not work in critical care area, even other department also, because then second one, you need to have in-depth knowledge about the disease condition, medication, and everything. Improve decision making skill. If the patient is going high BP, what is the next step? You need to have another. You need to have knowledge. What is the decision? Like the patient is showing the vital signs, you need to make decision. Those who are working in critical care area, enhance patient education. Now QR code, you can educate. No need to print the paper and give to the patient or family to read. You can ask the patient to scan the mobile. They will show all the detail about disease condition. Like patient is asthma, it will give how to prevent the asthma, how to use the nebulization, everything. So now everything is advanced going on here, advanced technology because all using what is that advanced technology we are using in everywhere nowadays. Then for next one is telemedicine and telenursing. Telemedicine. During the COVID, patient is having cataract surgery or patient, for example, I am giving diabetes. Example, patient is diabetes. So we know what is the diabetic complication, ketoacidosis, diabetic ketoacidosis, and if it is the retinopathy, there are a lot of complication in diabetic, mainly the chronic vulnerable patients. They cannot go to the hospital because all the hospital they are not accepting comorbid like the vulnerable patient because of the COVID. So they started the new technology of telemedicine and telenursing. That means the nurses will call. Patient can stay in their area. Like I can call in here if I am having any problem. So in India, video call, they will ask about all the condition. So they will enter the data, everything in the computer. So it will show what is the current. No need to explain more. No need to explain what medication patient is taking. Nothing. They will enter the data. It will show the patient health history. Then doctor or nurses can decide what is the next step. That is the good here. Still, it is going on. The patient is receiving the medication. No need to come to hospital. They will send. They will ask the patient condition through telephone or video call. They will ask if the patient need increase the dosage. They will send through the mobile vehicle or something. They will send to they will send to their home. No need patient to come to hospital. That is why advanced in telenursing, which is the use of innovative information technology and telecommunication system to provide nursing care from the distance. Here, what is our nursing role for the telenursing or telemedication, telemedicine or telenursing? Here, the nurse's role is you can see, like you can view the picture image here. Nursing management and continuity care at the distance and use of telecommunication and technology system to communicating between nurses and the patient and coordination support through telecommunication system. This is the nurses role. They will assign in one place, they will call the patient, they will ask the patient condition and the patient will explain what is my current situation is like that. I am receiving insulin. What is the dose, current dose? Then nurses will decide, okay, they will give education how to inject the medication, how to, where is the place, if you have any complication, do like that. But if you feel something uncomfortably, call this number and we will refer to telemedicine. So this all are the role, this all are the main role for the critical care nursing or those who are working in critical care area. But you need to have knowledge and communication skill to communicate with the patient. If you don't have knowledge about it, the disease, you will not communicate with the patient. Telenursing in ICU. Now, this is the latest nowadays. ICU nurses, physicians help monitoring critical patient and communicate using the audio and visual technology. It is going on. The critical care nursing, that means emergency area. There are a lot of ICU in everywhere. AICU means adult ICU, cardiac ICU, coronary unit ICU, pediatric ICU, NICU. This all ICU. This all the high dependency area. This all included in the ICU, that means critical care department, critical care area. But what is going on nowadays, like they are inserting the pacemaker, no need to stay, no need to assign any nurses. They are not assigning any nurse or 1 to 1 or 1 to 2, whatever it is. What they are saying, they are assigning only one nurse with the monitor. The monitor, they will enter all the data of the patient. So they are seeing the patient, their patient, where they are going. Patient is like their interval of moving the patient to avoid the pressure ulcer. So the patient is not moving within 1 hour. They will call the area. This patient is lying more than 1 hour. So they will say, well, they will call the patient. They will announce through the monitor, overhead projector, you how to move. Like the patient also attached, the bed also attached with the monitor or some video call. They will say, you need to move. They are the one giving education. They are monitoring the patient wherever patient is going. If the patient is taking extra medication, something like taking food, they will say the relative will bring food. They will not allow everything. They are monitoring through the one place. They are monitoring all the patient. So they are giving education through monitoring only. So telling us that means ICU nurses they will monitor the critical care patient. It is the big screen patient. If there is any ECG changes, they will call the head nurse or they will call the area. Patient ECG is changing. So go and see. If they are attaching with a pad or attaching with a probe or anything, if the displacement of probe, they will inform immediately. The monitor will show the alarm. So they will inform to the department in the probe displays. So they are observing everything through video or video monitor. So nowadays all the resources are reducing, and the advantage here they are using the current trend like lot of monitors and because what we are there are a lot there is infection if you are touching many times to the patient without cleaning, there are a lot of infection. Nowadays, the infection rates are reducing because we are not touching the patient nowadays. All through monitor, they are analyzing the data, giving education to the patient, taking care of the patient in on time. The patients are getting treatment on time and reducing the medication error, reducing other advanced event and everything because we are using now advanced technology. The most important priority area, as I mentioned, tele-intensive care unit. What all are the things? What all are the important knowledge? What all are the important things you need to have? The first one is critical thinking skill. If you don't have critical thinking, if something going on patient, you need to think critically. What is the next solution? How to solve the issue? You need to have critical thinking skill. Like you are studying now only the book, not only book. You need to apply your skill in the life. If you are not applying, only studying, you will not work in this type of critical care department or critical care area. You are not developing the skill. You will not move forward. We will do the whole practice. So, for student, I again teaching the student. Remember, not only reading, you need to apply your skill in your subject. You need to have experience that is common, skillful communication, respect for bedside, respect, the mutual respect is important, emergency patient care management, all these you need. Not only if the patient is unstable, how to deal with the patient. I don't want to read everything as I mentioned before. Of medication, monitor trend in vital sign, use the technology, how to use it, get orientation, how to interact with other people, and the most important point, without knowledge, don't take risk to work in high priority areas or high dependency areas. So the most important, continue your critical care nursing education. Education is most important. That's when you are studying, concentrate, understand your topic or understand your subject. Knowledge update regularly. Nowadays, a lot of research. No need to go to library. You can open your mobile and see what is happening in the world in nursing field or in medical field. You will update your knowledge. You will enhance your skill also. Adapt latest technology. Don't go with the paper recording and cleaning the syringe. Nothing nowadays. There are a lot of technology. Everything nowadays single use only. Critical care nurse need to have keep knowledge of latest information and develop skill to manage new treatment method and technology. Futures of critical care nursing. This is for you. Rapid and healthcare technology keep updating knowledge, and there are a lot of method. I said study bases, sensors, temperature sensors, telecommunication, tele-nursing. There are a lot of technology introduced. You need to have more knowledge about that one. Greater importance in place on efficacy, cost effectiveness, quality of life, and patient satisfaction rate. That is the most important. When you are working in the clinical setup, we are thinking about patient and family satisfaction. We are always focusing on patient-centered care, not individual center care, not our center care. We are not working only for the salary. We are focusing for the patient-centered care. If you want to focus the patient-centered care, you need to have knowledge about the and advanced technology. We are going to transforming our life. So you are also you need to go transforming technology. Don't go back the old technology. Evidence based, there are a lot of evidence. Go and read. Now all the most of the hospital they are introducing the AI system, artificial intelligence system. Read more knowledge about what is that. Not only appropriate research study, but you need to how to work in clinical area. And when you are reading the research study, find what all are the findings, and you need to think critical. Critical thinking is most important. So when you have knowledge, you will also do the lot of research related to new technology. Next one, what you need to have, you have competency based education. You need to have competent in everything. Without competent you cannot work anywhere. So then technical, now you are studying but apply your skill in clinical setup. When you are working in clinical setup only, you have to have knowledge, and you will work in everywhere, and develop the advanced skill. So what all are the characteristics? You have to have technical competence, relationship building, that means communication, coordination, conflict, this all the skill you need to have. Ability to multitask and set priorities. Multitask, there are a lot, you will not, I have lot of work. No, you have to set priority. Which one is this? Patient vital is change, ABC, airway, breathing, circulation. Follow whenever using, whenever doing. Now CABG, that is first circulation, breathing, and airway. That is most important. So always when you are taking care of the patient, don't look for lowest priority. Look for the highest priority. Take care of the patient, and you will get to the improved outcome. Then importance of evidence-based practice. Implement practice based on evidence. Evaluate your research. Read the hierarchy of the evidence. When you read more evidence, you will have more knowledge about the advanced technology or current technology in nursing. What all are the current, and there are trends and issues also going on. Reducing hospital readmission rate. Nowadays, everything through electronical, even patient, physician entry, also medical, physician order also through e-record, telemedicine, and e-ICU, as I mentioned. Nowadays, electronic ICU, patients staying in one area, they are monitoring through them. They are observing the patient through monitoring. So at the end, conclusion, due to the advanced technology and carrying based on scientific basis during the last 2 decades, critical care nurse provide your aim to be, always remember, your aim to be restore health, relieve pain and suffering the patient, support the patient, protect and uphold the right and dignity of the patient, maintain confidentiality also, that is most important. Finally, critical care nurses, at all time you must update your knowledge, continue reading the articles, and continue reading the evidence base. You will get what is going in, what all are the advanced technology in nursing. Um, you, Nursing, and you will develop your knowledge, and you will increase your skill day by day when you are reading the knowledge, when you are reading the many articles and evidences. Thank you.